helpful. And if I could just ask if you could make sure your mic is muted and camera is turned off, just to let you know that these sessions will be recorded and we will circulate the clips to all the attendees. So it is now 12 o'clock, so we'll make a start. So welcome to the North Yorkshire Safeguarding Children's Partnership May Masterclass. And today we're going to look at the world of suicide prevention in relation to safeguarding children. My name is James Parks and I'm the manager of the North Yorkshire Safeguarding Children's Partnership. And I would like to welcome Pat Sower from Starfish, who is our guest presenter and will be introducing herself a little bit later in the session. So please sit back, listen, and most importantly, I'd like you to share this learning with your teams and colleagues. If you do have any questions, please put them into the chat box throughout the session. My glamorous assistant, Natalie, will be taking these and feeding these back to us at the end of our slots. So if you do feel that you've got some questions that you would like to ask, then that opportunity will be available. Please note, as I say, these sessions are recorded and we will share the link with you via a YouTube link that, again, you can use and share within your organisations to ensure that we get the messages out there. So just before we start, what I'd like to do is just take the opportunity to highlight a few things coming up in June. Safeguarding Week 2021 is a virtual safeguarding conference taking place on the 21st to the 25th of June. And this is a collective partnership approach across safeguarding adults boards, children's partnerships and community safety partnerships. Across North Yorkshire, City of York and East Riding. And we hope that by coming together we can develop an extensive programme of learning opportunities. There'll be 1 or 2 hour workshops that you can sign up to throughout the day and some twilight sessions, and more information will be coming out across the partnerships in the next week or so. I would like to also bring to your attention our Hidden Harm campaign and ask for your help to get our eyes and ears messages out as far as possible. So we've published a podcast, which is our first podcast as a partnership, which talks about the signs of hidden harm, what we're doing collectively across North Yorkshire to try and tackle that as well. So we will circulate some links to you and there is information on our social media channels and on our website. And again, I'd just like to encourage people to think creatively about how you can help us get those messages out using your school social media channels or through organisational channels, possibly putting something in newsletters, e-bulletins, just trying to get those messages out far and wide. So just going into our main area of topic, really, I just want to provide a bit of a wellbeing warning. I'd like to promote the wellbeing warning around the subject of suicide. A number of us will have been affected either personally or professionally by suicide in the past. And we know that this subject can be quite difficult for some to talk about, but what we'd like to do is raise the profile of suicide prevention and mental health in general, remove the stigmas associated to it, and have more open conversations around mental health, and particularly around suicide today. If you do feel that you need to sort of step out of the session, please feel free. We will be signposting a number of organisations throughout the session today. So again, there may be some opportunities for you to link in with those organisations. It's important that you utilise the support that is available within your own services. So I know for a lot of you, you'll have in-house services or external services that can support staff with wellbeing. One of us will be on the chat at the end of this webinar if anyone feels that they would like to talk things through, and also if you feel that you just need to take a step away from the webinar, then feel free to do so. We need to really remember that we need to look after ourselves so that we can look after others that we care for and are supporting. So without further ado, let's start by looking at the work of the Suicide Prevention Task Group. So today's session, I'm just going to provide an overview of some of the work that we've been doing, and then I'm going to hand over to Pat Sower, who has been working with us, and she's going to share some insights from her own experience around suicide prevention. So following a review of 7 child deaths relating to suspected suicide over the last 3 to 4 years, we have seen over that increase, child deaths increase that have come to light through the Child Death Overview Panel. And as part of this CDOP, which I'll refer to the Child Death Overview Panel for the rest of the session, it was agreed that suicide prevention would be one of the 2 priority areas for CDOP to look at over 2020 and 2021. And we've just confirmed last week that we'll continue this priority into the next financial year. The Suicide Prevention Task and Finish Group was created and involves individuals from the organisations that you can see on the screen. The Task and Finish Group have pulled together a terms of reference, and I just really want to touch on the 3 areas that we are focusing on within this Task and Finish Group. One was to undertake an audit across the services across North Yorkshire and the City of York to understand the suicide prevention support that is available for both professionals and parents and carers, and children and young people themselves. To seek out research which can inform practice on suicide prevention, and then ultimately look at how we can either put some recommendations and oversight into the implementation of some actions that are going to have a practical impact on the work of suicide prevention across North Yorkshire and the City of York. The Task and Finish Group is set up for a 6-month period, and we're in month 5 at the moment. Next month, next week, we will conclude the Task and Finish Group in June, and we will embed some of the recommendations and actions into the various sort of work streams that are across the City of York and North Yorkshire Safeguarding Children's Partnerships. I think it's important to take some time just to note really that since March 2020 we've had no suicides or suspected suicides notified to CDOP. And I think that is a real positive, given that we expected at the beginning of the pandemic that we would see an increase in suicide or potential suicides across the country. And I know within the adult population, sadly, that has come to fruition, and we have seen an increase in suicides amongst the adult population. There have been suicides regarding children within that time slot, but within North Yorkshire and the City of York, we have not seen that expected increase, which for me, I hope that we can follow this trend and it continues as we make collective efforts to support the suicide prevention, ensuring children and young people ultimately get the right support by the right people at the right time. So I'm just going to talk you through the recommendations that we've identified. Some of these are poignant to individual organisations, some are collectively across a broad spectrum of partners. What we fundamentally need to look at is the training offered to frontline practitioners, support that is offered to parents and carers, and also to children and young people themselves around social, emotional, mental health, but also obviously focusing very much today on that suicide prevention aspect. So across all partnerships, what we would like to see is a recommendation that suicide prevention awareness training is embedded within your organisations. Just like maybe first aid or health and safety or basic safeguarding training, we want to make sure that suicide prevention is something that people are talking about, and we're again removing that taboo subject. The Safeguarding Children's Partnership within North Yorkshire, we will be looking at sort of packages that we support. So I know from a local authority point of view, they offer a basic safeguarding awareness training to partners, which is an e-learning package. So we're looking about how we can embed aspects of safeguarding in there. So again, it's on people's radars, and it's something that people are talking about in a positive way to try and tackle the increase increase that we see in potentially nationally. The Task and Finish group have also pulled together some school-specific information. As a safeguarding partnership, we create annually a draft sort of safeguarding schools policy. And when we were reviewing this, we noticed that actually we don't actually include anything around suicide prevention within that policy. So that's in our gift to include. So we've been working with colleagues who are some on the call today and some other education colleagues to look at actually how best we can make sure that we're putting that information directly into policy. And if it's in policy, then hopefully individuals will be aware of it, they can act on it and make sure that that sort of suicide prevention agenda continues within their broader sort of mental health and social emotional mental health work that they're doing within their schools. Having spoke to a number of head teachers around suicide prevention, sadly after an incident has occurred, it struck me really about the preparedness of how schools are for a death of either a child or potentially a staff member. So making sure that there's critical incident plans in place, just as you would have for sort of lock-ins or lockouts if there was a terrorist incident. Do you have a plan for a child death, be that suicide or a life-limiting condition that you might want to put an appropriate response to, or if you sadly had a child involved in an accident, again, how do you deal with that? So rather than waiting for that that time to come, is actually kind of doing a tabletop exercise and walking through those steps before and putting in place some plans of action. The next recommendation is a recommendation that we've identified and actually been able to act upon fairly quickly. So we have now a dedicated resource, and this isn't just about suicide prevention, it's around bereavement support for parents and carers, children and young people themselves, that signpost local organisations, gives some resources, some materials, some information about all things bereavement really. So again, this is a site on our website that you can access this support through. And as you can see, Natalie's putting some of the links into the chat again, and we'll circulate these slides so that you can access these specific pages. Moving on from a sort of a training aspect, one of the things, again, in terms of embedding that sort of suitable training offer to staff, what we'd like to do is encourage all professionals who work with children and young people to take 20 minutes out of their time to undertake the Talk Suicide training. So this is part of the Zero Suicide Alliance and the Humber Coast and Vale ICS that operates within our patch have a dedicated resource, which is the hashtag Talk Suicide campaign. As I say, it's a 20-minute, very informative sort of introduction to suicide prevention. There are a variety of other training resources available that are a more enhanced or kind of in-depth opportunity to look into the subjects, such as Safe Talk, Assist, mental health first aid for children and for adults. I think within North Yorkshire, we're really fortunate to have the Head First website, which is the headfirst-northyorks.org. And this is a website that Public Health have funded to put all things suicide prevention training into one umbrella. And again, if you work or volunteer within North Yorkshire, you can access the training on that site for free. And it's a real valuable resource. I know we've got colleagues from the City of York on today's call, and again, you will have access to within your local authority area suicide prevention training. I know Andy Chapman, who's the suicide prevention lead for York, is continually promoting training out to the City of York colleagues. So really important, have a look at the website. Like I say, 20 minutes, you can undertake the Talk Suicide campaign. And if we can get everybody having that kind of basic understanding and awareness around suicide prevention, the better, I feel. hot off the press that came in yesterday was again specifically for North Yorkshire. North Yorkshire Education and Skills have initially funded 4 courses in the Ask Suicide workshop. So this is assessing suicide risk in children aged 5 to 14. That gives you some really practical solutions, information about how to assess risk and inform safety planning. So the dates are listed on the slide. There's a number of courses there that are bookable. There is 1 free place per school, with priority initially given to staff within secondary age schools. This is open to all schools, including independent schools, maintained schools in North Yorkshire. So you can book direct through the North Yorkshire Education Training website, which you've booked today's sort of attendance at this masterclass. So really valuable sort of training that we know from education are asking for. And then I'd like just to really raise around the self-harm and suicide ideation pathway. Some people will be familiar with the pink or the purple looking document that's been around now for a couple of years in North Yorkshire. We've taken some time to review the document, and we've now, as you can see, the other image is our website. We've now moved this document into the website itself so that it's more accessible and has different sections for different individuals and different colleagues. So education, children, young people, parent and carers, and general information for the general public. This is a pathway that we are working with the City of York to embed. So we have 1 pathway across the city and North Yorkshire, which I think is really important to ensure consistency across our partners, because I know not all partners just work in North Yorkshire or just work in York, but collectively will work across the 2 local authority footprint areas. So if you do have the purple pathway, if I could ask you to delete that and remove that and signpost individuals to the new pathway that is online, we can be more proactive in terms of updating information and making sure if services change that the most recent information is included. And then finally, really, I'd like to just touch base on the child death review aspect. And this is for all child death matters, really. When we were speaking with individuals from school, they were saying that they felt sometimes unprepared when they were faced with that phone call on a Wednesday morning and coming into school and sadly receiving a call that a child has died. We've got a 1-minute guide that explains the child death review process. It provides, we have some training that we would encourage all individuals, irrespective of who you work for, to undertake. It's a virtual training course that just, again, it's that prevention. It gives you that sort of opportunity to have a think about the unthinkable before, or hopefully if it never happens, but if it did happen, that you've got some knowledge that you can use and move with. So that's just a bit of a whistle-stop tour, really, of some of the developing areas in the recommendations, and there will be a number of others that we will continue to review and to include, and we will circulate out to partners some of the key findings and some of the asks, really, that we would like individuals. It isn't just the responsibility of the partnership. Everybody in the community has to have an important aspect to play within suicide prevention. So I'll just ask Natalie, I don't know if there's any particular questions that have arisen just from the task and finish group in the chat.
Nothing as yet, just Lucy mentioned in terms of us recording the sessions, those will be published. I know we've still got last month's to launch, but they will be published, and I will send out links to all the delegates from last month and today to say that they're live and you can go on there and download those.
That's great, thank you. If anyone does have any questions, again, please feel free to add them in the chat and we'll pick them up after Pat's presentation. So without further ado, I'd like to welcome Pat, and I'll ask Pat to take over the slides.
Thank you, James. And listening to that, I was reflecting on how we first met. which was shortly after the CDOP for Dom. And to see the work that you're doing now for me and to be involved in it is fantastic. I think the initiatives you've just talked about on the Task and Finish group are really amazing. So thank you for handing over to me. I'm just going to give you the opportunity to tell me if you can't see me or the slides. So if you can't, that would be for James or Natalie to shout out for me, please. And otherwise, a very warm welcome to everybody who's made it onto the session, and we're recording. So anybody who hasn't been able to make it today will be able to watch back later, which is fantastic. James did mention safety, so I just want to reiterate that, because I suppose my role in this mini masterclass is to put a personal slant on some of the initiatives and why they matter and why we're asking you to take some personal action and responsibility around it. So I am going to talk about my own experience around suicide, and I'm going to frame that around the loss of my son Dom. And some of you may know Dom if you have lived and worked around Harrogate for a while. He was here, and you may even have taught him, and you might know me. So please do look after yourselves as well. When this photograph was taken, Dom was 17, and we were on holiday in Italy in the days when you were allowed to go to Italy. And if you'd asked me how I felt at the time this picture was taken, I would have said that we were out of the woods, that Dom had a really rocky 14 to 16, but he was now through his lower six, had the best year he'd ever had in school, and was talking about going off to university. And in fact, on this holiday was working on his notes on his English lit texts. But 8 weeks after that photograph was taken, Dom was dead. And that's why I now do what I do. So I'm speaking to you, yes, as a suicide prevention person by bitter experience, but also as a former teacher and head teacher, and most of all as a mum, and also as a friend who is still working with lots of people, whether they're in education or other professions, or just as friends, helping them navigate their way through keeping their children safe. And I want to share with you today some of Dom's story. It's only one story, but also some of the things I've learned in the process of becoming and understanding what we can do around suicide prevention. So as I'm talking through that, what I'd like to invite you to do is to make the connections back to your own roles, to your own professional sphere of influence, to your own sphere of influence at home, so that you can start to make the connections between what James was talking about in the initiatives and what each of us can do, because suicide prevention is a whole community affair, not just one individual, not just one family, not just one professional. So I said that there were some things around Dom's story that I would share. It's never straightforward, suicide. It's nearly always complex. There's a temptation to try and fix it on one point, one causal point. But all of the work I've done to understand suicide and the process towards it suggests that for most individuals, there's a complex picture of vulnerabilities and risks and life experience all coming together in a crisis point that means they don't know how to cope and they don't know where to turn. Fundamentally, it's a loss of hope, and not able to see what can be done to make life better. And that's where suicide prevention comes in and interacts with safeguarding in whatever roles we're in, because if we spot those kind of things early and resolve them and work on them, we reduce suicide risk. So in Dom's particular case, he was, you know, people try and put some separation between people who die by suicide and other healthy children or adults. And the honest truth is, I can't give you the comfort of that. Dom was a pretty normal teenager. He did have some family history of suicide. He had some early bereavement. He had some trouble around his sexual identity and emerging as gay, which resulted in some bullying at school that didn't get resolved particularly well. But underneath all of that, he was a boy who wanted to be alive and really loved life, a fabulous musician, a great baker, an artist. And so, yes, he did have some vulnerabilities, but he's not somebody who wanted to be dead. And often around suicide prevention, it gets framed about character and being stronger and being resilient. Actually, Dom was hugely resilient and very good at problem solving if something was going on. But he ran out of resources and he didn't get the support that he needed at the right time. Things are changing for the better. Even in the 3.5 years since Dom died, the landscape is changing rapidly, and this session is probably a good example of that. But it's really important to change your picture of what a suicidal young person looks like, because they're not necessarily visibly presenting it. And just to put that in context, I'm sure you'll have seen the iceberg model used in lots of different ways, but in the terms of suicide prevention, it's a really important model to keep in mind. What we're seeing on the surface may be nothing like what's going on underneath. And in fact, lots of the taboos around suicide prevention mean that we assume that if nothing's said, that's the best place to be, because it feels so weighted and frightening. Even as professionals, we respond on a human level to ask directly about suicide. So under the surface, all the taboos, all the roiling feelings and emotions that we need to be able to tap into. And that doesn't have to be a specialist job. So one of the most difficult things for me to learn after Dom died was that there is a whole body of knowledge around treating and preventing suicide, which wasn't shared widely enough, because it needs to be in the hands of parents and professionals at every level, whether I'm talking about children here, but we all interact with different human beings every day. And so we all need that skill set. I'm starting to think of it as being the equivalent of the defibrillators that we mark off around towns and buildings, so that we know how to deal with a crisis if we have one. That's what we need for suicide prevention. Because the problem is, for all of us, that we see the top of the iceberg, and we all seem normal till you get to know us. You see my outside, I know the inside. And the only way to reveal that safely is to know how to have a conversation about suicide prevention. As I was preparing for the session today, I listed, and I won't have collected all of them, the people who had one-to-one interaction with Dom in the 2 years when he was struggling in school, age 14 to 16. I'm going to read them to you. GP, A&E team, a consultant who he was referred to in that A&E team, his band leader, a clinical psychiatrist, the crisis team members, his teachers, his form tutor, the school counsellor, the school nurse, the police, a paramedic team, the school chaplain, the head teacher, his music teacher, his family, his friends, and everybody else he came across. And that's just the ones I can remember right now. So he came across a huge number of people who, if they'd had some basic training in suicide prevention, might have noticed enough of the signs and symptoms that I now recognise but didn't know how to look for before he died, and might have saved his life. I did say suicide is complex, and the way I liken it, and you'll have to forgive me if you've seen this before because I'm going to keep using it, we used to play buckaroo in our family, and so suicide is a complex combination for every individual, not necessarily one causal factor, but perhaps a build-up of things. And just like buckaroo, you might have the big thing, the big TNT that makes it kick off, or you might have lots and lots of small things, but either way, eventually the load becomes too much. I'm hoping this video will play. So our aim as individuals and as professionals is to try to stop that mule bucking, to try and stop suicide early. And I'm going to talk through now some of the things that I've learned as a result of going through that terrible terrible loss of a young person with so much hope. And I'd love to tell you he was the only one, but it's not true. The local news is fantastic in terms of the latest figures on suicide prevention, but it really, really is not time to let our guard down. With the number of young people who are coming forward presenting with other mental health issues around anxiety, eating disorders, depression, it's really vital that we keep the suicide radar on, switched firmly on. So we're trying to intervene early to prevent suicide. But it is time to put our positive pants on, because when Dom died, I had a choice between accepting the status quo and just dealing with my own personal grief, or trying to understand it and change the future. And the strongest sentiment I had, apart from all the shock and grief alongside Dom dying, was this is just not right, and we must be able to do better. And that's why I'm doing what I do now, to try and change the future so we can save those lives instead of accepting it as an inevitability. And the thing I liken that to is around our beliefs about cancer treatment. So not so long ago, if you got a cancer diagnosis, it was a death sentence, and it was speaked within hushed tones and referred to as the big C. So suicide is the big S, isn't it? It's the equivalent thing, but for mental health. And we have to have a professional outlook of hope and improvement, because if we don't have that, the frame of reference professionally is helplessness. Oh, I don't know what to do, so I won't ask. Or if they want to do it, they will. That's an expression of helplessness rather than proactive change. And so as individuals, yes, the whole system can improve, and we can fund and invest in suicide prevention treatments. There's plenty to learn and do, but it's not an either or with individual knowledge. We need to take individual responsibility as well. And to be really honest, my biggest wish is that you do not have to experience suicide personally to understand how important knowing about suicide prevention is. So here's some of the very basic things that I have learned already. You might have known them. I learned them too late for myself, so I make it my job to share them. Some of these might sound a bit basic, but you'll have to forgive me. It's really not uncommon as a professional to not know that you need to ask about treatment plans, and to check that the people who are treating a suicidal person have the right qualifications, confidence and skills to deal with that situation. It's really important to ask, to build a level of expertise into the team supporting a young person. To, in your roles, learn about the impact of trauma and taking a horizontal perspective on an individual who might present with a suicidal crisis. So when we've dealt with the crisis, let's take a horizontal view. With Dom, some of his risk factors were early bereavement from his grandparents. He'd lost a cousin to suicide. He identified as gay very early. They're all, I learned afterwards, vulnerability factors for suicidal risk. So as professionals, learn what the risk factors are and start to weigh them alongside your more general safeguarding risks. If I can only say one thing, it's this: the only way to know if somebody's suicidal is to ask directly, are you having thoughts of suicide, or are you having thoughts of taking your own life? And then listen to the answer and take it seriously. And that's the core of suicide prevention at community level. James has mentioned some of the training. I'll go on to talk about it again. And then I talked about access to treatment, and I know you will all be aware of some of the waiting lists and pressures in the NHS. How could we not be? But it does mean if you're in a position where you can lobby or allocate funds, please do it. Mental health, early mental health treatment is probably the most important part of suicide prevention. Follow your instincts, even if you're a professional. Follow your instincts. You can't make somebody suicidal by asking, but you have to rule it out rather than assuming it's not happening. And then I do actually believe the concept of love and care also relates in a professional setting, but it's not enough to care. Let's get trained. Find out about local and national support, which is what you're doing today. Keep it in a folder where you can find it, because when the pressure's on and you're worried about somebody, it can be a real stress to not know where to look for the material. and then make sure you look after yourselves too. And that capacity is really important. So some of the work I'm doing now is around staff wellbeing, teacher wellbeing, because if you're not in a good place yourself, you've got less space to notice and look after other people. And then the last point I'll come on to in a minute, hoping for the best, planning for the worst. Not waiting till you're dealing with a suicidal youngster to think through what the plan might be, but thinking about it ahead of time. That point about love is really important. When I left hospital with Dom after his first suicide attempt, I wanted to know what to do to look after him, just like I would have if I'd been sent home with him on crutches or after a brain injury. But I was told to love him. I did love him, but it's just not enough. And so knowledge and skills are really important, and that's where all the training stuff comes in. So what can you do about it individually and collectively in your organisations? Get trained, ask directly about suicide, learn how to listen to the answer, and then know how to signpost to support. And if you take those 4 steps, you will save lives. A lot of it links to what James was saying. So I want to put that in a wider context of mental health, because in mental health terms, suicide is the crisis point. So when we talk about well-being and mental health in schools or education settings or in hospitals and wherever you are, what we're really talking about is early intervention to save lives. And early intervention is probably one of the most used phrases I've heard in safeguarding and education settings. But what early intervention actually means is catching people before they get to crisis. It can be easy to miss because we can assume things will resolve on their own. So when we have watch and wait, that's okay, as long as we do actually check back in and make sure we're resolving issues, not leaving them to sink down but remain as a fracture line. Why does it matter? Mental health in perspective, you'll have seen these numbers, but think about your own settings. 10% of young people age 8 to 15 have a low sense of well-being. 13% currently meet clinical criteria for a mental health disorder. And that may not necessarily be being suicidal crisis. It might be all sorts of different disorders. In the longer run, at the moment, you can see in the stats that 1 in 4 adults has a diagnosable mental health condition. So that tells me, as a lay person, that we're not resolving the issues in childhood to the point where it's helping us manage adult mental health. So we need to get in earlier, quicker, with more support. The reason education settings, whether it's primary, secondary, sixth form, further education and university, the reason that's such an important setting for suicide prevention is because the vast majority of mental ill health does develop before the age of 18, but takes about 10 years currently to get diagnosed, and that's a real period of vulnerability. And yet, the reason for the hope and the full glass of milk, the vast majority of people who experience a mental illness go on to recover and live fulfilling lives. So what we're talking about here is triaging the people who don't need to die, but are the most critical and difficult cases. Suicide is preventable in the vast majority of cases if you get effective intervention. And that's one of the hardest things I've learned. One of the things that's been coming out strongly in the conversations I've been having recently is about the professional taboo, that perhaps as individuals we go to work and we know what the policies might be, but we bring ourselves and all our cultural baggage with us too around mental health, and that there might be a second layer of taboo around suicide in an organisational setting because we know it's not politically correct to admit that we feel a revulsion towards the concepts around suicide, so we therefore don't deal with it and it gets buried. James mentioned that the work we've done in the Task and Finish group around putting suicide prevention in the policies is aimed at changing that, so that we can, when we can admit the cultural barriers, when we can admit that we find it really frightening or upsetting or can't understand it, that's how we start to break down the taboos around suicide. So some of this here today, the stuff that the Task and Finish group have given you, is the tools to open up a conversation in the workplace that says, we need to get suicide prevention on the table, because that's our best chance of avoiding it. That's our best chance of saving lives. I'm not going to dwell on this slide. I'm sure most of you now, I hope, have come to the conclusion that mental health sits alongside physical health. We all have it. It's a state of well-being. The one thing I would say is that it's really that first paragraph, a state of well-being, you know it when you see it, in which every individual reaches their own potential, can cope with the normal stresses of life, the ups and downs, can work productively and fruitfully, and is able to make a contribution to their community. That comes from the World Health Organization. It, for me, provides a bedrock for assessing how well you're doing as an organization, because that could easily be the statement that is required state of culture for individuals to learn or thrive in life. So apply it to the whole situation, not just to mental health and illness. And this model here is really just to put that into a picture. So we often notice when people are really struggling. We often notice when people are absolutely flying. So it's the bit in the middle that matters. When we're doing fine, great. When we're starting to struggle and when we're really struggling, that's where early intervention comes in, to try and avoid going into crisis. So this model here, just as a self model, but also to speak to young people about where they might put themselves on that model, helps you start to think about the fluidity, and also the really important message, which is that suicidal crisis isn't a sort of moment. It fluctuates, it can reappear, it can resolve. And so asking once doesn't mean you don't have to keep checking in and keep making sure that somebody's safe. The reason I'm so interested in it as a culture challenge is because if we teach everybody about mental health and then in crisis situations, suicide prevention, we reduce stigma and we increase the likelihood of people coming for help. And that really matters, because if you have stigma, if you hear people calling you a snowflake, pull your socks up, just get your head down and get on with it, you're weak. If we see suicide and mental illness as a character flaw, if we see risk factors as being something to blame parents with, all we do is reduce the likelihood of people coming forward for help. And this has been brought home to me on a very personal level this week, because I hurt my back for the first time in ages, and I couldn't work that day. I didn't hesitate to tell the people I was working with what had happened to me, to go and get some help, go see a chiropractor and get it sorted out. And I've probably been boring people about it all week. But how would that have been if it'd been a mental crisis that had frozen me in the same way? Even after everything I've been through, I would think, what will my clients think today if I phone them and tell them I can't do it because I'm really struggling with my mental health? And so the stigma is going to take us a while to remove, but we have to work on it. It's not an excuse to leave it the same, because that's what stops people asking for help. I've talked about this already, but please remember, hope is the best position for suicide prevention. We can deal with it if we tackle it head on. We have to ask about suicide directly. You cannot make somebody suicidal by asking directly, but you can make them feel safe. Are you thinking of taking your own life? The 20-minute training, talk suicide training that James mentioned, is really, really useful to start that process of becoming comfortable around asking. And then the helplines, which Papyrus Man, are really important to mention, because as professionals you can phone for a supervision, debrief or preparation for a conversation, as well as pointing young people and their families and friends towards it. So that's a really important resource to have access to. The next point is about your 3 trusted people, and that links to a piece of suicide prevention work which shows that loneliness and lack of support network are 2 really big vulnerabilities to suicidal crisis. So if you can start to name 3 people who you would tell in that crisis, we start to make people safer. So I personally have 3 people who I know I would tell, and I'd invite you to think of 3 people too, and that makes all of us in this room a little bit safer straight away. And in your professional capacity, I think it's really important to mention confidentiality and risk to life, and balancing and thinking through those. The work that's been done on the suicide prevention part of the safeguarding policy template fits with this, but the concept where risk to life overrides confidentiality in extreme situations. So please, especially with young people who are crossing over that boundary from young child into young adulthood, please do bear that in mind. And remember yourself, if you're having thoughts of suicide or caring for somebody who might be, do take responsibility. It's an individual person action, saving lives from suicide. So that's where, on the community-wide culture change, effectively, we're changing the way we talk about suicide and mental health. All the prevention, early intervention, the recovery when you have been ill, all the self-help and the professional support feeds into mental health and well-being in our community. So I said about planning for the worst and hoping for the best. Planning for the worst. James talked about policies. Look at safeguarding. Have suicide prevention directly mentioned, both in wellbeing for staff and for students or young people in your care. And make sure that there's easy, visible access to suicide prevention information and signposting to support. Sudden student death includes suicide prevention response. So people are much more comfortable. It's very tragic. It's just as tragic. Loss is loss. Death is death. Accidents, illness. Because the frame of stigma around mental health lies in place, over the top of that, people find it much harder to include suicide in that. So I'd say make sure you do. Make it a visible part of that death management process, because by doing that you will pre-arm people and keep those affected safer as well. Make sure you know your local resources, get trained, we've talked about all of that, and make sure that you've built it into curriculum. When are you going to talk to young people about suicide? Because they're thinking about it anyway. They might know somebody who's had a suicidal crisis. How are you going to persuade them that breaking the confidence of a friend to keep them safe is the right thing to do? Tackle it within the curriculum. And then think about staff induction and professional development, making sure that it's covered off in those areas. And then in terms of hoping for the best, this is where the prevention comes in a positive frame, by making sure that your wellbeing strategies, building resilience, problem solving, how to negotiate arguments without falling out, getting mental health first aid training or wellbeing training, and there's lots of different versions of that, and making sure there's access to counsellors or coaches or mentors for adults and children. Building a relationship with CAMHS before you need it, so you know who to talk to, and then making sure you share knowledge and resources with families and train them in turn. Make sure that those safeguarding early warning signals actually cross over into pastoral management and wellbeing for young people. And making sure that the skills underneath are there. Doing this minimises the risk of suicide, but it doesn't remove it. So you still have to have suicide prevention skills in place, because life.
Sorry,
we need to stop.
Just to say 5 minutes, and then we've got time for questions.
Yeah, clocked it. So we just need to be ready for the worst by preparing for the best. I'm not a great believer in guilt. I don't find it a very useful emotion. So we do the best as we can till we know better. And when we know better, we do better. So my invitation to all of you is to apply that. I'm going to skip these slides so you know they're there. Some of them have got positive resources. So when we come to suicide prevention, there's 3 levels: general awareness, what we're doing today, learning the skills to talk about suicide, and then developing specialist skills, which is what assist training is. Here are the local supports which complement what James had at the beginning, in terms of places you can go to for support. And here are the kind of training things you can do in suicide prevention. So right from that 20-minute online training that's free, through half-day and 2-day training courses. So the gold standard is applied suicide intervention skills. One of the things that I would love to see is that every setting has access to somebody who is trained and qualified in suicide prevention. so that when you're dealing with things on the ground, you know you've got someone to turn to. And that's the detail on those. I'm going to step back to my Dom. Next Tuesday, he would have been 21. This is not how I planned to spend the weekend before his 21st birthday. Every priceless life has been calculated at £1.2 million worth of cost. So I would like to invite us as individuals who represent a system, a country, an area of the country, whether it's York or North Yorkshire, to focus some money on saving those lives instead. I'm going to invite you to accelerate change, take community-wide responsibility, and I'm going to flip to my final slide, which is asking you to take a little minute to pledge what you will personally do with the widest possible remit of influence that you can find for yourself to make a difference to the future. Thank you for listening. I'm going to leave you to write, and then I'm going to hand you back to James, and I'm hoping we will have some questions.
Thank you very much, Pat. While people are just sort of sparing a minute just to have a think about what action you're going to take away, we'd love to hear some of those. And if you feel that you could pop those into the chat feature, sort of what your takeaway from today is, and how you're going to help us collectively kind of work to the suicide prevention agenda. As I say, it'd be really interesting to see what people are going to take from that. So we've got a bit of time now, really, just to, I suppose, have the opportunity to ask some questions, and happy for people to come off mute, or if you want to pop your hand up, and I'll come to you with any particular questions. Nat, I don't know if we've got any pre-questions that have been asked within the chat at all.
Nothing as yet, James, in the chat.
Would anyone like to be brave and ask a particular question?
James, I can see somebody has put a great pledge in there, actually, so it might be an idea to share the pledges, saying they're not going to be afraid to ask the question. And somebody's asked us for the link to the Zero Suicide, Talk Suicide training.
Okay, yeah, we'll pop that link into the chat for you. As I say, it is a really good interactive, quick way of capturing that information. There is also, if you are connected with business, with organisations, as organisations, you can sign up to the Zero Suicide Alliance, and there is training packs and resources that employers and employees can utilise as well.
Nobody's got any questions. We must have a fully confident team.
Pat, I suppose looking at the opportunities where you've had to speak to individuals, what are the main questions that you're asked?
Yeah, so I often, the biggest question I get asked is, but what if I make them feel suicidal? So I think underneath all of it, the biggest worry most people have in the training I do and in the individuals I speak to, the question is often, what if I make them feel suicidal? And just that reassurance that you can't, you'll just become a safe person to talk to. And then one of the other questions I get is, who do I turn to? Where do I go to for help as a parent? Because the children get wrapped up by the system if the system works well, but the parents or carers might be a little bit floundering in terms of where they go for their own support. So that's why I think the pathway and the resources that you've introduced today, the wider we can get those disseminated, the better. Because the one thing I've noticed over the last 3 years, I carry this in my head like a little encyclopedia now, but I'm astonished at how many people have never heard of the North Yorkshire Safeguarding Pathway or the suicide prevention stuff that Papyrus do and CAMS and all of that kind of thing.
Yeah, and I think that's, I suppose, the important takeaway, really. I would hope that people will take back to their organisations is those practical sort of steps, really promoting the pathway, which has a variety of different access points for social, emotional, mental health, not just for suicide prevention. And I know particularly within schools and other organisations, mental health is high on the agenda. There is a number of resources and funding being put into that. So the pathway does detail kind of what the available services are for children, young people and families across the county, and also that'll be including across the city. It's great just looking at some of the questions here. We can see that we've got sort of organisational trainers who are currently reviewing and preparing suicide training to be rolled out across their staff. So again, kind of picking up on some of the key messages that will hopefully get disseminated far and wide. We've got people who've already done the zero suicide training and are thinking about additional sort of training around the Ask workshops and Assist and Safe Talk, which is really positive. And as I say, if you go on to the Head First website, there is a list of all of the available opportunities. And also, if you are a trainer yourself and would like to sign up to support the delivery of suicide prevention training, there's sort of train the trainer options as well through that. So I can't see any specific questions, but if people do want to put stuff into the chat, and we'll come back to you with some answers. Just to I suppose round off today's presentation, really, and about that message about how we get information out to the children and young people workforce. Each month we produce an e-bulletin where we try to highlight some of the key areas that we're working on as a collective safeguarding partnership. If you're not signed up already, you can do that on our website. If you go to the professionals tab, and then there's an e-bulletin sign-in link. You can also follow us on Facebook, Instagram and Twitter, as well as obviously our main website with a variety of information. So this is a series of mini masterclasses that we have developed really during lockdown. We try to do these on the last Friday of every month. Our next masterclass will be looking in partnership with the North Yorkshire Police, Fire and Crime Commissioner's Office about the services that they commission and offer for children and young people and families around sort of child abuse and a variety of exploitation services that are on offer. So please feel free to sign up to that masterclass. It's on Friday the 25th of June. Sorry, no, it's not. That's today. Oh yeah, Friday the 25th of June. I'm thinking it's June now. And you can book yourself onto the webinar through the NYES website. So if we don't have any final questions, I'd just like to say thank you very much for attending. A big thank you to you, Pat, for sharing your insight, and thank you for your continued support with the partnership and the work around suicide prevention. So I hope everybody has a lovely bank holiday. You get some much needed downtime and rest. And for those that are in education, enjoy your half term. So thank you very much, and we will see you next month.